World Health Organization and the Institute of Medicine have independently called for the redesign of professional healthcare training and continuing education programs. Why is this important? And if our healthcare training programs are inadequate, why do physicians come from all around the world to train here?
We have some of the top universities and top medical schools in the world in the United States, so let's be clear about that. But according to the Institute of Medicine, Crossing the Quality Chasm, we have to retool and redesign medical and healthcare professional training programs and continuing education programs. We have a mismatch between traditional training and continuing education programs in medicine and other healthcare professional areas and what patients need. We have patients with chronic diseases, so the kinds of training methods that we use to educate professionals are just not fitting with the needs of the population. So we really need to redesign that. And the Institute of Medicine felt so strongly about this that a panel was formed after Crossing the Quality Chasm, and that panel of leaders from different specialties, from medicine, nursing, many others, got together and put together a roadmap for doing just that in 2003. The World Health Organization had a similar kind of effort that was focused on creating a 21st century healthcare workforce. Chronic care improvements, a major focus of that. And interestingly, both of these organizations came up with very similar recommendations, that we need a new competency set for healthcare professionals. So we need this foundational competency set for helping professionals be successful in improving quality, delivering patient-centered care, using technology, demonstrating cultural competence. We have a much more diverse patient population, facilitating behavior change, supporting self-management. This is the foundation. And these are interdisciplinary components. So we have this interdisciplinary foundation, and then we have the specialty areas built on top of that. But see, the way the healthcare training and continuing education programs work is it's very topical, specialization, and we don't have that foundation. If you look at how most other industries have implemented consumer service initiatives or any other kind of quality improvement programs in manufacturing, what do? They get everybody on the same page, working from the same playbook about what everybody needs to do day to day. They create a shared vision. They communicate and articulate what the business case is or the burning platform for change. And so that's something that we need to create as a foundation for all healthcare professionals. Right now, if you look at it, most professionals, myself included, we get on a plane, we go to a conference, and we associate with people in our own field. The language that we speak, every time I try to explain to my wife, what it is I do, it becomes very complicated because you begin to be a specialist in your area. And then you get back on the plane, you come back, and you work in the setting. If you're doing clinical work, you're working with other people, other professionals, other disciplines. And what we really need is to focus on how we can change practice in the actual setting where care is delivered. Whether you're a disease management organization or health plan working with people by phone, whether you're a physician, nurse practitioner, pharmacist, what is it that you're going to do differently? And that is an interdisciplinary process. And cross-functional teams are used in other organizations to get the job done, to make sure everybody is working from the same playbook. So that's why the Institute of Medicine and World Health Organization have focused so much on that. I mean, they've been very clear. We cannot change our healthcare system without addressing this issue. And it is a terribly difficult issue to address. Since the IOM and World Health Organization reports have came out, I don't think we've seen much change in healthcare professional training programs. I certainly haven't seen much change in in continuing education programs. They are still using the same methods of instruction that are very academic. They're not using what the kinds of learning and development, competency-based development programs that are used widely in most other industries. So I think that needs to change, and we've been a big advocate of that and a supporter of that.